Content in this video should not be construed as medical advice. It is for information purposes only. Please consult your physician with any health concerns or questions.
I'm Dr. Barbie Sullivan with the Women's Clinic, and I'm an obstetrician and gynecologist. I take care of women of all ages, pregnant women, women who have problems associated with menstrual cycles or going through menopause. Uterine fibroids are benign tumors of the uterus, and what that means is that they're not cancerous. They are muscular tumors, so they actually originate from one muscle fiber. And I sort of tell patients the uterus is like a big muscular organ, and it's like a knot in there. It would be sort of like if you had a Charlie horse in your leg, and that type of knot of muscular tissue, but it's permanent. It's not, it doesn't come and go. We don't know what causes them. We do know that they tend to run in families. About 1 in 5 women of childbearing age will have fibroids, and then by the time a woman is 50, about 50% of women will have fibroids, more common in women of color than Caucasian. Some women have fibroids and they're completely asymptomatic. They don't have any symptoms at all. But the more common symptoms that we see would be some type of abnormal bleeding. The tumors can protrude into the part of the uterus that you slough off every month when you have a menstrual cycle. And when they do that, they can bleed out of cycle, so in between periods you can bleed. And they also can cause really heavy menstrual cycles, blood clots, pain. Those would be some of the more common symptoms. If they're large, you can get pressure. You may feel like you need to go to the bathroom all the time because the uterus and the bladder sort of sit right against each other, and they can put pressure. Sometimes women will get some pain with intercourse related to fibroids. There's not really a standard treatment for fibroids. It really depends on the types of symptoms that they're having and the size of the fibroids. So say someone who's having heavy menstrual cycles, we would use the traditional treatments that we use for heavy menstrual cycles, which would be birth control pills or any of the hormonal contraceptives, so a vaginal ring, an IUD that has hormones. All of those things can help control the bleeding in a lot of patients. If they're large and they're causing things like pressure, or if the woman is of childbearing age, wants to have children, maybe is having fertility issues, sometimes we actually go in and take the fibroids out and leave the uterus intact in that case. We can do that. We used to only do that open, so we would make an incision on the woman's abdomen, a lot like a C-section incision, and would take the fibroids out through that, and she might be in the hospital 3 days and have a lot of pain and development of scar tissue and that kind of thing. With the advent of the robot, the Da Vinci robot, that is a great tool for taking fibroids out. And we can do it laparoscopic and stitch the uterus back up. We do these procedures many times as an outpatient, so the patient most of the time goes home the same day. And then depending on the patient, you know, the typical patient that we're going to do that type of procedure on is young, and so they're going to get back to work somewhere between 2 and 4 weeks as opposed to the 6 to 8 week time off work, have less scar tissue, better preservation of their fertility, less chance of infection, all of those things. So that's a great procedure for somebody who wants to have children. It's not a good procedure for somebody who wants a permanent fix, because about 25% of those are going to come back. So despite the fact we take the fibroids out, a large number of them are going to come back with time. The permanent treatment for uterine fibroids after we use hormonal treatments and things like anti-inflammatories for pain and would be a hysterectomy. And fibroids are, in America, the #1 reason that we do hysterectomies. Another treatment for uterine fibroids that is partly experimental is you can embolize uterine fibroids, and this is done through radiology, so they can put a little catheter in and actually put a little substance in that forms a clot or a blockage in the vessel that's feeding the fibroids, or in the vessels that's feeding the fibroids. And essentially what happens is the inner part of the fibroid dies and it shrinks. And the reason I say this is sort of partly experimental, it's a good treatment for some women, but as you can imagine, as that shrinks down and dies, that can be quite painful. And so there are probably more than would be acceptable number of women who are still going to end up needing a hysterectomy after that. There are also some procedures where we can just get rid of the lining of the uterus, and again, those don't work as well in women with fibroids, but they work for some women. So some women say, I want to try that before I go the hysterectomy route. If you're having symptoms of heavy bleeding or pain or pelvic type pressure or pressure against the bladder, that is something that you really want to discuss with your gynecologist when you come in for your annual exam. Let them know that you're having these symptoms. I think sometimes women assume that that may be a normal part of aging, or that those symptoms may just be normal. And also, we can't always feel fibroids on a physical exam, and many times it really takes an ultrasound or sonogram like you have when you're pregnant to really look at the uterus and to see the fibroids and to be able to know where they are and sort of how to best treat them.
Thank you, Dr. Sullivan. If you are experiencing pain, discomfort, or abnormal bleeding, please contact your physician at the Women's Clinic at 601-354-0869.